Hi, I'm Dr. Nicole Vane, and in this brief video, I just want to discuss a little bit about the reason why we do tongue tie releases in children and adults, upper and lower frenectomies. The frenum, or frenulum, as some people call it, is that little piece of tissue that's underneath your tongue and the one that's underneath your lip. In some of my other videos, I talked about how my son had to have both released at the first week of life to get him to breastfeed properly. And it's amazing, as I've learned more and studied more, how impactful it is on people's bite, occlusion, and the development of their jaws. More than ever, we're seeing children that are tongue-tied. And even if they were released at birth like my son, they often need what are called revisions. Or they might have had a tie all along, and as long as they were able to breastfeed, the standard of care is just to wait until they're older. So we see this thick banded tissue underneath the lip or underneath the tongue or both. There's a great book on it if anyone wants to do more research on their own called Tongue Tied, and it's by Richard Baxter. And then there's a series of lactation consultants that chime in also. And another book I talked about last time was 6 Foot Tiger, 3 Foot Cage by Dr. Felix Liao. And it talks about how if our tongue isn't given the freedom in our mouth, our arches will never develop properly and will never develop a proper swallowing habit. So these are some of the things I'll discuss with you if you come in for a new patient exam as a child or as an adult. Because as an adult, some of these factors that have gone long undiagnosed, again, most dentists don't even look at this, cause a lot of grinding because their tongue is tied down and their arch never developed enough room for their tongue. So at night, they jut their lower jaw forward in order for them to breathe. Or on the flip side, with children, a gappy smile is pretty normal. A lot of times it's because of the thick attachment underneath the lip that leads to the teeth being pulled apart. So if they pull up the lip, you'll see just this thick band of tissue. And there's quite a few photos that we'll also have on the website. The reason I got the laser is how phenomenal it is to do these tongue tie releases. It takes less than a couple minutes. It needs hardly any numbing. I've done several with the parent sitting right next to the child, and both have been shocked at how easy it was. So we have a setting on the laser with what's called a chisel tip. And literally when we lift up the attachment and pinch the tissue, it's almost like using a laser scalpel that we just slice through the tissue, it releases. Then I can use the laser to score down to the periosteum, which is the bone, to make sure it doesn't reattach. Then we have a special dressing we can put in afterwards so it stops bleeding, and then you're on your way. It's pretty amazing. I mean, there's quite a few on adults we can do with almost no numbing at all. There's a pre-numbing analgesia phase, and again, it's so quick with the laser, and the laser, because it's not a scalpel, releases so easily. I'd like to come out with a series of videos on myofunctional therapy also, which will be coming in 2019, just to be able to show people the exercises they can do to then strengthen the tongue or lip, because when it's been tied down for so long, it's just like an elephant who has the little rope around its ankle. That elephant could have walked away at any point in time. It just was so trained having this little rope around its ankle from when it was an infant that it couldn't walk away, that it's now just programmed into its subconscious. So a lot of times our tongue needs retraining. What are the benefits of that? In children, it'll help them develop facially better. It'll help their upper arch when their tongue gets to the end spot. If they're properly swallowing, then they're going to have a broad, beautiful upper arch, and their lower arch will guide in to follow. Now, sometimes things get tied back, and children will have this buck-toothed appearance because they have an overly tight lip or tongue. And I'll talk about that more in some of the myofunctional videos and with the myobrace. But in adults, it can lead to sleep apnea. So I can also use the laser to open up the back of the throat with something called night laze, which helps bring in more air. So if at any point in time on any of your exams, a tongue tie comes up, or if that's something that you would like to talk to me about by coming in as a new patient, I'm here at any time. It's something I love to discuss because it's so impactful on children's facial development and the breathing of adults. So feel free to ask me at any time. I'm always here to answer questions.